postpartum intimacy. And we have Liz Dube, who's a local marriage and family therapist who specializes in sexual dysfunction. And I'm going to let her kind of give some background on where she practices, what she does, her areas of expertise and interests, and let her take it away. So.
Thanks, Q. Well, I have a practice in Long Beach. That's where I see clients face-to-face or video chat or telephone, because that seems to be the culture right now. So we try to manage in whatever way we can. I'm a licensed marriage family therapist, and I'm also a certified sex therapist. So the majority of the clients that come to see me are focused on something related to sex and sexuality. They're wanting help with that, whether it be just their own sexuality or the way that they are wanting to improve intimacy with their partners. And I blog on my website at talksexwithliz.com. And you can also find me on Instagram, that same at talksexwithliz.com. And if you DM me, I will DM me your questions about this talk. I will definitely respond and get back to anyone who DMs me, because I know a lot of times questions that people have they feel a little bit shy and don't really want to ask them in this type of an environment. So, and also since it's going to be recorded, then people can DM me at a later date too. So I see clients in LA County, Orange County, all around the area. And I love speaking and talking because I'm always listening. So it's always refreshing to be able to have an opportunity to be able to talk and have fun. And so I'm really looking forward to having fun today and talking about something that's so near and dear to my heart. I'm a mom of 2 as well. And thank goodness they're teenagers now, although I don't know, thank goodness, because sometimes they feel like toddlers. And, but I so remember so vividly what it was like to be a new mom, and how tough it is to be able to balance those roles and to be able to find your sexuality again after such a really invasive experience carrying a baby and having a baby. So I'm glad to talk about this topic today.
So the topic is postpartum intimacy. So we know that most questions are pretty vague, right? How can we liven it up? How can we get back to what it was? But we obviously know that there's layers to that. So you mentioned needing the context whenever dealing with clients and needing to know the relationship and all of that. So can you speak to what the components are of a healthy sexual relationship or intimate relationship?
Yeah, I mean, I think generally speaking, whether it's post-baby or not, a healthy sexual relationship is something that is not performance focused, first of all. That's number one, because we want to make sure that it's focused on sex, it's focused on pleasure and connection. Mm-hmm. Whereas a lot of times we get into these habits about like efficiency. It's about getting to the orgasm. And ultimately, you know, that's a great part of it, but that's just the period at the end of the sentence, that we really want to enjoy the experience with our partners. And if we don't have things like novelty, mixing it up, if the sex isn't worth wanting, if it's just really about getting to that orgasm, we stop wanting it. And also it needs to be consensual. And while we look at consensuality from a space of, you know, when we're dating, but consensual in a long-term relationship also means that I'm not going to get punished when I say no. I'm not going to get, you know, criticized that I didn't want to, you know, do what you want to do sexually. That we need to be able to feel like, yeah, I'm interested. I desire that. I'm doing what I want to do sexually. Mm-hmm. And so that's, I think, a really important component, especially post-baby, because we're going to feel really different about our bodies. We're going to feel different emotionally and physically. And so we need to make adjustments and give ourselves some compassion when we're reintegrating sex. And a healthy sexual relationship involves that direct communication about where you're at, what's changing for you. And the person that you were having sex in your 20s is different than in your 30s and 40s, pre-baby, post-baby, et cetera, et cetera. Does that make sense?
Yeah, definitely. And I've actually heard that from a few patients saying, you know, I feel like there's a timeline. Everybody wants a timeline. When can I? When will I? When will it feel better? And it's hard because everybody's very, you know, everybody's on their own journey. So it's very difficult to give a blanket statement. But I've heard the phrase, you know, I feel like I'm doing it more for them than me. And too, because they want the progress, but the desire, like you said, isn't necessarily from within. It's to maintain the relationship, which is a priority too, but where's the
Yes.
balance in that, right?
Yes. And I mean, and there's ways to be able to make it for ourselves, but it's pretty hard to switch the light switch to
Mm-hmm.
go from mommy and struggling with body image to, okay, now we're going to go to bed and it's sexy time.
Yeah.
There needs to be a transition. When you were dating and when you were prioritizing your femininity, your sexuality, you were doing things to make to fuel your desire. And so it wasn't magical that you had desire for your partner. And so it's going to take some effort. It's going to take some consciousness, some intentionality, some prioritizing. And if you aren't doing that, then it is going to feel like it's just for them.
Right. Yeah. And obviously we know with postpartum transitioning physically, which we see a lot, the body changes tremendously, which is one thing.
Yeah.
Also a lot of insecurity with body image and body awareness, because everything does feel very different.
Mhm.
So I know you have kind of a checklist of things that you discuss with your clients to kind of
Yeah.
restore the intimacy postpartum. So what would you say are the kind of top things that you really emphasize with your clients who are struggling with this?
So, I mean, first we want to normalize it.
Mm-hmm.
Because of course you're feeling like, of course, this is a difficult transition. A baby at like how many pounds that came out of your vagina or your stomach? I mean, of course, there's going to be some difficulty. This is like as natural as we want to make it. It doesn't feel so natural, and the adjustment after that is exactly that. There's an adjustment. So first off, be compassionate with yourself and give yourself a break, and don't pressure yourself into jumping into sex. And so give yourself some time. So my first thought is that step one, don't stop shooting on yourself.
Yeah, I like that.
Oh, I should have sex for my partner. Oh, I should be doing this as a good wife.
Mhm.
The moment that you start shitting on yourself, you have squashed your sexual desire. That you wanting to want to have sexual desire. Sure. Okay. I want to have sexual desire. Great. Let's start making some intentional efforts towards doing that. But let's stop criticizing ourselves that we're growing this humongous stomach over 9 months, really 10 months, because come on, I really hate that. Like,
I know. Then that
yeah,
is that's
come on. It's 10 months. It's 10 months, people. So that piece right there is we've been carrying a baby for all this time. We've been already, you're in this place of doing something like your body was for someone else, and then you finally get that baby out of there, and now it's going to take your body another 9 or 10 months to be able to get back to where it was. And your body still isn't even its own. Those boobies are not tits anymore. Those are mammary glands. Like that, there's a lot going on here. So give yourself a break and go slow. Um, uh, the challenge here is going to be that step 2, women are socialized to sacrifice.
right. Yeah.
I mean, this is how we're socialized. It's like, okay, I'm supposed to be a good mom. I'm supposed to be a good wife. I'm supposed to keep a good house. And then I'm working on top of that. And then I got to go to work after 6-8 weeks that you popped out that baby. So there's so much going on there. So first off, like, give yourself permission to take it slow. And your partner may not be thrilled about that you're taking it slow. But it's okay. Like,
Yeah.
I just want to give people permission that they get to do that. And the insight about the fact that women are socialized to sacrifice, that to think about that, to say, okay, how can I start approaching my life in a way of pleasure? So instead of me, as soon as the baby's napping, saying, okay, now it's time for me to clean some bottles, clean some house, run an errand. No, it is now time for you to rest. It is now time for you to fill up your tank. If your tank is empty, there's nothing, you're not going to be feeling sexual. You're not going to be feeling any desire to be sexual. You've got to handle the basics of survival, food, shelter, clothing. Yes, but we need rest and filling ourselves up in ways that feel good. And so that's key, is getting the rest that you need and not going straight to the sacrifice piece. And if you're in a mental space of, okay, how can I possibly take a break? I think that's going to help you to be able to have the energy and the desire to be open to receiving touch from your partner. Okay. And then, step 3, the sex has to be worth wanting. If the sex isn't worth wanting, why would you make it a priority? Of course you'd rather sleep. Of course you'd rather go and hang out with friends. Of course you'd rather maybe clean your house so you can enjoy and reap the benefits of a clean house. But ultimately, if sex has to be worth wanting for you to desire it. So, I always use food as an analogy. If you go to a restaurant and the food isn't good, are you gonna be craving that pizza? No, it wasn't any good. No, thanks. I'm not going to that restaurant again. And if it's only good half the time, you're like, oh gosh, I don't know. It's not really reliable. I don't really know if I want to go back to that. And so being able to go into something that the sex is worth wanting. So are you and your partner communicating in a way where you're saying, hey, I would really love to be touched, and I'd really love to be in a sensual place with you tonight. But this whole penetrative sex thing, I'm not wanting intercourse tonight. I'm wanting some tapas, no main entree for me tonight. I'm going for the tapas. And if you want to finish up with a shower after and take care of yourself after, great. Okay. But the obligation for you to be giving your partner an orgasm, no. An obligation for you to connect with your partner and to make your partner a priority as well. Sure, of course, that's so important. You had a baby with this person. That just as much being a good parent to this child is to be able to provide a loving relationship for this child. But you being able to communicate with your partner and to be able to say, hey, this is what I'm hungry for, this is what I'm horny for tonight, and communicate to make the sex worth wanting, you're going to desire it. Okay. And if you aren't desiring it, then that's when you DM me your question on how to make it more desirable. That's when you schedule an appointment with me to be able to work through what is it that you're wanting, that maybe there's a disconnect with you and your partner. Okay. Right. So being able to say, hey, these are the things I'd really like, and being able to find out what they like and navigate that. You don't just say, yeah, we're going to Thai. And they're like, hey, I just had Thai yesterday. I'm not really interested. I really like pizza, as long as it's a good pizza restaurant. Yeah. Right. So
yeah, when you said you need to prioritize for yourself, the rest, but also the intimacy, but it being surrounding your pleasure, not your partner's pleasure, to do it as an obligation, and having to be worth wanting. The concept I like between outer course and intercourse, because everybody glorifies penetrative intercourse, which is very intimidating postpartum, which with the pain, which I think is number 4, right?
Yeah. Okay. So yes, outer course is so important. Sex is getting naked and having pleasure and being connected. It doesn't mean that there's penetration. Sex, there's no definition of that, there has to be penetration for you to have had sex. Mm-hmm. And I like to call it, a pleasure session or a sexy time. It doesn't have to be this idea of penis vaginal intercourse. Right. That it's let's do this one special thing that we only share together. Mm-hmm. And let's go to that place together. But if it feels like all you're doing is going to the place of where your partner what your partner wants, and you're not, and it's not a mutually satisfying experience, then of course you're not going to want that. But let's not be all or nothing in our thought process and our approach to sex and sexuality, because this is what stops people, is they say, well, I don't want to have outer course because then my partner's going to want to have intercourse. Yeah. Well, have direct communication with your partner saying, I'd really enjoy to give and receive some oral, to massage each other, to play around, but I really don't want to have intercourse tonight. And I think, that's something where your partner can feel connected to you and still feel like they are desired. But when we cut our partners off and say, I'm not going to hug you, I'm not going to give you any affection because I'm worried that I'm going to be teasing you. And then that means that, then I'm going to have to deal with the you being upset and disappointed. It's like, no, we're all adults here. Let's have some direct communication. I know no one was taught this. I mean, I wasn't taught this before I started this profession. And to be able to be about like saying, what are you wanting? And to not approach it from an all or nothing perspective. If your partner says, hey, I'm hungry, and you say, do you say, oh, well, I'm not interested, you say, oh, okay, you're hungry. Okay, well, I'm not really that hungry, but I maybe I could have an appetizer. I'm open for an appetizer. And so, maybe they want to, it's like, we don't have to not eat. Maybe you say, oh, I only want dessert. Or you say, you know what, I'll go and I'll get something to drink. Mm-hmm. I'll play around. Yeah. I'll join you. Right. And so moving away from that all or nothing mentality. However, yeah, like you said, step 4, sex should never be painful. Okay. Yeah. If sex is painful, you're probably going to be like, I don't even want to look at the restaurant. Okay. I don't even want to look at it. I don't want to think about it. I'm getting like, I feel anxiety just thinking about the pain that I might experience. Mm-hmm. And it's, of course, so sex should never be painful. And so we should never be in a place of where we are going to grit and bear it. No way. And that's where outer course is so fabulous, because usually outer course is not painful. Okay. I don't think I've had too many, I don't know. Maybe I have, who knows, in all my years, maybe someone said outer course was painful. Maybe nipple play was painful. I don't know. But so being able to allow yourself to say, you know what, I don't want to have intercourse yet. I'm working on that. I'm working with my physical therapist on the pain, but we can still play in all these other areas. You've got your hands and your mouth. There's lots of other, you've got your clitoris. There doesn't have to be any intercourse to get to your clitoris. There doesn't have to be any sort of digital penetration, nothing. Like, you can get there. Okay. So being open to other things, but never feeling obligated to tolerate pain so that your partner can have pleasure. That's not okay. Unless that turns you on.
Right. Unless it's a preference, then. Yes. But yeah. And I think it's important to recognize that it's okay to communicate your boundaries, because you said earlier, when the breasts become cafeterias versus, different, there's a different role there. I had a coworker actually bring up that she had a patient who was on top of her partner, and he kind of like grabbed her and she started lactating. And that was just unexpected,
Yeah.
Some hormones, there's a physiological response there, but be aware of like, hey, can you not touch there, because there's a chance of that. And so you don't have a moment, right? And so that's nice to kind of set the tone and the expectation. I do have a side note question, because I know we refer a lot of patients to you, but there's that imaginary 6-week mark that OBGYN after birth. And we always say, everybody's on their own timeline. But is there, there's obviously no magic number, but is it more productive to kind of at least talk through it before you develop symptoms? If there is already the anticipatory, it's going to hurt, I don't want to try, so I'm not going to I don't want to look at the restaurant, I don't want to go, I don't want to look at the menu, I don't want to go, we'll see, talk about it later. Is there benefit to doing that before this, early on, before even attempting it?
Well, I think that it's always, and you're talking about talking with your partner, right?
Setting the boundary, setting the tone.
Yeah. So I would say context, again, is important, meaning that different people who have trauma in their background, people who have pain in their background, are going to have more of a painful and anticipatory pain response. Whereas people who don't, that may be listening to this, that have no history of pain in their sex life, that it may be less of a concern. But I do think that in order for people to have a sustainable, satisfying sex life, there needs to be direct communication. there needs to be an expression of what I want and what I'm scared about, what I'd like more of and what I'd like less of. And we really want to embrace our feminine energy when we're communicating that. And I hope everyone knows what I mean by that. I, as a really strong, powerful woman, often don't use my feminine energy and so I'm very clear when I'm in my feminine energy, but sometimes I forget when I'm in my masculine energy, where I get bossy, where I say, oh yeah, I didn't like it when you did that, and don't do that again. That's really, oh man, our egos are so sensitive when it comes to feedback. And so I never want us to not communicate to our partner because of fear of hurting their ego. But what I want to encourage is that we're communicating in a way that's gentle and compassionate, and recognizing that if your partner is a man, he's having a hard time. He doesn't know what's going on with this female body, and he can't read your mind. He really needs help. This is such a gift for us to be able to say, I'm really wanting us to have this special intimacy again, but I'm really scared about pain. And so I don't know, I'd like to really just start with some outer course and to start a conversation about that. Yeah. And if your relationship isn't such that there's emotional safety, there isn't respect where you can communicate that, then there's some couples counseling in your future.
Yeah.
And a lot of this is based on the assumption that people are in a place where they can communicate their wants and needs to their partner, and their partner will be receptive to it. And certainly everyone's going to we're all human. I'm defensive. When I don't use my tools, I'm showing up as defensive. I'm showing up in my boss lady energy. But when I'm using my tools, and then I can communicate in a way that my partner can hear me, and I can get what I want. Yeah. And so after this time, he doesn't know. Okay, are you giving the go? Am I giving the go? Every couple has their different dynamics. Like, were you always the initiator of sex, or was your partner always the initiator of sex? Did there not have to be an initiator before because it was always so mutual and it was like easy to read? So this is a whole, especially if this is your first child. I don't know if I should say especially, because I think child number 2 is often so much more exhausting when you've got 2 juggling. So I don't even know which is harder, the idea of just having a first child and this is all new, but then adding a second to it and trying to juggle all that. But so there's nothing easy about being a new parent, whether it's the first or the second or the third. But the communication is he or she, your partner needs to know, what do you need? Yeah. What do you need? And if it's the 6-week point and your partner is pressuring you, get an idea of like, well, so you're really, really hungry, huh? You're wanting to go out to a full, steak and potatoes meal, and honey, I'm pretty full here. So here's what I'm thinking. Can we start with, here's my boundaries. Here, can we start with this? I really want to get naked with you, but I feel like maybe I want to wear a baby doll because I'm feeling insecure about my stomach, and I'm like, I don't want to lactate. And so those are being able to identify what it is that you're feeling comfortable. And if you have the energy, I mean, this is the thing too. I mean, maybe when women weren't working outside the house, maybe when women were getting help from the neighbors, from family members, from the village that used to be family. Mm-hmm. But now I think people are so isolated, especially with COVID. And we're going to talk about that a little bit today too. But there's so much isolation that just randomly saying 6 weeks or 8 weeks, now you're ready for sex. Are you really ready? Are you experiencing postpartum depression? If you are, then you're probably not ready. If it was a really painful birth and you've had some trauma there, then you're even less ready. If you're feeling a disparity of chores and you're feeling some resentment towards your partner? Are you really wanting to be close to them? I mean, this causes a rupture. A lot of people get closer after childbirth, but a lot of people get farther because you go, wait a second, what? Like, I did 10 diapers today and you did 2. Are you kidding me? That's not fair. And so all that energy is there. And so I think that we can't ignore the emotional piece. Your OBGYN, all they're talking about is the physical piece. And this is not just about the physical. This is about the emotional, the sensual, the psychological. And so there's no easy answer to this. And so that is a benchmark that medical doctors give based on saying, like, it's no longer going to be a physical problem.
Right. Yeah.
And that's also assuming that you don't have pain in your history. Okay. So
exactly. Yeah.
Yeah. So
a lot of the strategies just involve the open and honest communication, because it does bleed into, well, who changes more diapers? Who's going to get up for this feeding? Who's going to work? What time do you get home from work? Who's going to bring dinner? Who's going to cook dinner? And it sounds like a lot of that can still be applied to intercourse. It's just we're not taught how to do that. Right. So the benefit of you who specializes in it is getting the tools or getting the strategies of tone, right? We don't always know how we sound. We just say what we say. We are who we are. But it sounds like there can be some practice, even if you're not necessarily, I feel like a lot of people will try and maybe not be successful. Maybe there's pain, maybe it wasn't enjoyable. They have to stop and then they seek help. But it sounds like there's a little bit of wiggle room to at least get some strategies for communication if that's something that you're fearful of. Right.
Sure. And it gets to look however you want it to look. So let's move away from any idea of like what is normal. Okay. And let's move into what feels okay for you and what you're interested in. But this leads me to step 5 or tip five, prioritizing sex. Okay. So in order for you to actually have it, you've got to make it a priority, because now you're juggling an additional responsibility. There's a lot going on. And in order for you to be able to, assuming sex is worth wanting and assuming you're feeling physically okay, and assuming now you're starting to embrace pleasure and move away from sacrificing, now you're moving towards, okay, how can I make it a priority? And part of making a priority is getting the rest, the direct communication with your partner. It's an elephant in the room. Let's not ignore that it's quite likely that your partner would like to be sexual with you. And your partner might be excited that there's not a baby in your belly anymore, and even more horny because that's the case. And so let's not ignore that they might be waiting for you, feeling like, well, I don't want to pressure her. She's done so much, but I'm really longing for that connection. And so don't leave it to be the last thing in the day, because you're so exhausted. Oh my gosh, you're so exhausted. If you want to approach sex, then schedule a nooner during nap time. Schedule something in the morning when you're feeling like, oh, okay, I have a little bit more energy. And take those opportunities when you can. So when you've got that break and you go, oh, I should clean house, I should clean bottles. No, you say, no, let's schedule some time. But part of that may be too is if we go back to everything that we've talked about, this idea of like, well, I'm really scared. I don't know what is it going to be like. And there's the boundaries with the boobs. Like, I don't want you to play with my boobs. Like, these are the babies. I mean, these are mammary glands. Like, this is for the babies. Like, I've had a baby sucking on my boob, and now I'm going to have my partner sucking on my boob. It just doesn't really, like, for most people, it's not really a turn on. And for a lot of people, they can't compartmentalize from one to the other. And so they need to have that separation. And so that separation might be a sexy bra, and you keep it on, and that's okay. And being able to say, what is it that I need to feel more desire to be in a sexual place with my partner? Yeah. And you make it, and initiating those conversations with your partner will help. That's part of the prioritizing of saying, hey, I would like to be physical with you, or I'm really nervous about being physical with you. Can we have a talk about that? And here's what I'm thinking, and
Mhm.
share what you're wanting. And that you're going to show up in a much more soft and compassionate energy than when your partner tries to initiate and you're like, oh,
Right.
really?
Mhm.
And so initiating it, you're going to have a much better energy for your partner, and it's going to feel they're going to be much more receptive.
Yeah. And I think people forget that intimacy is also doesn't have to be physical. It can also be that the vulnerability of being honest and expressing what you miss about your sex life, or what you want to revisit and try and practice and see how it goes first, not
Mhm.
expecting full penetration just yet, right?
Yes.
One thing you're notorious for is that the brain is our biggest sex organ.
Uh-huh. Mhm.
Therapy, we talk a lot about the fear, pain, tension cycle, and
Yeah.
usually that first time, I mean, maybe everybody's excited. Maybe there is no fear. Maybe it's like, let's do it. I've been waiting six
Mhm.
6 weeks and one day, and you try, and then maybe it is very uncomfortable. And then
Mhm.
there's all of a sudden this dark cloud of I my expectation wasn't met. So now,
Mhm.
the brain remembers those things and the nervous system remembers those things. So
Yeah.
I think that
Yeah.
speaks to your next point, which is whatever you focus on, right? Is that
Gets bigger. Whatever you focus on gets bigger, and it's not just penises. uh, yeah. Yeah, my guys with erectile dysfunction go, Liz, that joke doesn't work for me. Um, yeah, your brain is your biggest sex organ. So if you think your parts are broken because you're not feeling arousal in the way, like you're not feeling like a sense of excitement and pleasure in a way that you were before, it's likely you're not thinking sexy thoughts. It's
Mhm.
likely that you're thinking something about the pain, or you're worried about the baby. Like, if you're not thinking sexy thoughts, your body is just aligning with whatever your mind is up for. So it's like it's all connected, the right legs connected to the, whatever, right? It's all connected. So um uh, if you've had pain in your history, there's going to be that memory in your brain where you're going to have that anticipatory response. If you haven't had pain in your history, but then you have pain that first time, that it's important that, okay, so if this is your first time experiencing pain, let's not catastrophize.
Mhm.
It's not uncommon for people to experience pain that first time after having a baby. There's a lot that's changed with us hormonally, and that's having an impact on our vulvas. And you can speak to that so much better than me, Q. Something's going on there that creates some pain, and it's only temporary pain
Mhm.
right after the baby, and that can likely go away quickly, or you can go to your OBGYN if you're not getting results within a couple of weeks of something showing up differently in your body. Then you go and check with your OBGYN, check your hormones, make sure, like, are things in balance? Is there what's going on with my estrogen levels here? That might be the source of the pain. It may not necessarily be something that is actually physical and that you would need your physical therapist for. And so those are much more easily resolved symptoms, because it's just that such large spikes in hormones and dives, right? Is that right? Q
Yeah.
is like, uh-huh.
Estrogen drops down after estrogen's like riding high the whole time, and as soon as baby comes out, it plummets. And then with breastfeeding, if that's the choice of feeding, then it's even more pronounced. And it is sometimes a lubrication issue, but what a lot of people are afraid to say, right? Closed mouths don't get fed. So unless you are open about communicating that to your partner or whoever, sometimes the answer is as simple as find a lubricant that you both like.
Yes.
Instantly something changes. But it's
Mm-hmm.
that lack of I don't want to say anything because I don't want them to feel like they're hurting me even though there is pain, or I don't want to, maybe next time I'll just try to avoid it. You kind of talk
Mm-hmm.
out of things. And a lot of, with the brain being in charge, I tell people, fight, flight, or freeze. If
Mm-hmm.
your brain is thinking you're in a panic, even though there's not an imminent threat, but it's in the back
Mm-hmm.
of your mind, your hormones are going to shift. Aside from the breastfeeding hormones, your cortisol, your adrenaline, everything is going to create the bodily response that is not conducive to something that sex requires, which is relaxation and oxytocin
Mhm.
and love and all of that. So
Yes.
really worth prioritizing the focus and learning how to reframe things and communicate them.
Yes. And if you have pain in your history, then you're like your brain is all those are going to fire so much. They're going to remember. They're going to be like, "Oh yeah, we know this jam. Here we go." And so there's going to need to be some adjustments. You may need to take it slower. You may need to do some touching exercises to start to get you in a place where you're feeling excited and relaxed. You need both of those for sex to be pleasurable. You need to be relaxed and excited. They seem like they're in conflict, right? But excited is not like anxious. Excited is like, ooh, I'm feeling this is hot. I'm feeling aroused. I'm feeling like, ooh, that I'm excited about what's happening and what's going to keep happening. And then the relaxed part is I feel safe.
Yes.
I'm okay. I'm going with the flow. What you're doing, I'm trusting my body to go with the flow and do what feels right. And then if things aren't, if you're having a pain response, then you're checking in with yourself and identifying the pain, slowing things down, seeing if, can you enjoy penetration without thrusting, without pain?
Right. Yeah.
Or do you need to have no penetration at all and say, no, okay, I need you to pull out. We can't have any penetration. Like we need to do some outer course and
Yeah.
we're not ready for intercourse just yet. And that's okay. But the brain remembers. So we can never move forward, continuing to have sex when there's pain.
Right.
Because otherwise you have that pain and then your brain remembers. So now it's going to have the anticipatory response and it's going to be really hard to get it out of that loop. So
Right.
we don't want to be doing those things. And then the other aspect of like whatever you focus on gets bigger is just sexy thoughts.
Yeah.
Thinking about, instead of being like, oh, I wonder if it's going to be painful, I'm so scared that it's going to be painful, instead focusing on, I can't wait to feel my partner and us to have this special time. I'm thinking about these great sexual encounters that we've had before. I'm thinking about past times where we've made out on the couch and we grinded each other and that was so hot and heavy, but there was no penetration and it was okay. And I'm thinking about the parts of them that turn me on. I'm thinking about the parts of me that turn me on. I'm thinking about other fantasies or anything that turns me on to be able to stay in that turned on zone. And you could use the five senses as a guidepost for that. So you could use the idea of like, okay, I'm going to play music that makes me feel sexy and turns me on. I'm going to light some candles or burn some oils that make me relaxed and in a space of like, yeah, here, like that brings back memories of good things for people or not. So, you find something that works for you. The taste, that could be like thinking about how their body tastes to you or not. Taste is not always applicable to people in the moment, but that can be hot where you're like tasting the salt on their body and it's like, oh, that's hot, that's sexy. Then there's the touch. It's just noticing, oh, like how much softer this part of their body is and how much cooler or warmer this other part of their body is, and noticing the curvatures of body parts. And then visually, focusing on the things that turn you on. If you're feeling insecure about some new stretch marks or some new belly fat, some new stretched out skin that you're not liking, don't look at it, okay? I remember I learned this early on from one of my doctors. I remember I went to the doctor and I said, what is this dot here? And he's like, it's nothing. Just, you're looking at it too much. Just stop looking at it. It's like, okay, I guess it wasn't cancer. So he just said, stop looking at it. And so I guess it's this idea of like I said, like whatever you focus on gets bigger. And so focus on the things that turn you on. If you're liking your new boobies, I mean, that can be fun. They're like, they're bigger, they're full, they're yummy. Then focus on those and enjoy those.
Yeah.
And yeah, so you focus on the things that turn you on. And then when a thought comes in where it's something that's unsexy, you just let it float away. And then you bring yourself back to the moment of the things that turn you on.
And so say somebody does that and they've worked through their fears, they've had the talk, they've hired a babysitter, whatever it is, they're ready to go to the restaurant. What are some practical strategies to do that? Because I know I mean, you just show up naked, open the door naked and, you're ready to go.
Ta-da!
Versus are there some, baby steps or maybe different strategies to reintegrate that?
Yeah. So I get people that are in very different places within their relationships sexually. And so I really try to meet people where they're at. And so, you'll have to consider, all the listeners will need to consider where they're at with this advice, right?
Yep.
These tips is that, the couples who have, if you have a partner that's great with spontaneity, and your partner's really easily aroused and they are just ready to go all the time, sure, you could just ta-da, and there you are naked and you're ready to go and you guys figure it out. But a lot of couples, a partner might be like, I didn't realize you were ready for sex. Okay, let me see if I can get this thing going. And if they aren't reacting to you in a way that feels really positive and inviting, that might trigger some insecurities in you with this new body and all this stuff. So really think it through, because it might be more effective to let them know that, oh, I'm interested in us getting together, and can we start with making out on the couch? Or I'd really like to do some erotic massage. I think that's a great place to start. Is you get some oils and you say, honey, can you go out and buy us some oils? I'd really like us to do some erotic massage. Now, don't put those oils in your vagina, ladies, please. Okay. We don't want oils in our vagina. We only lube in your vagina. Okay. And, coconut oil, there's still research that's on the fence of whether or not that's okay in the vagina too. So everyone's got different levels of sensitivity. So, just be smart about that. Always that caveat. But so think about what you're ready for. And then I think it's a better conversation to have over dinner personally. I mean, I think it's like, hey, baby, I've been thinking about you and I'm missing you. And at the same time, I'm kind of scared about what it's going to be like for us to have intercourse. Can we, like, maybe tomorrow, or can we maybe do some massage? Or I'd really like to, like, maybe we could take a shower together. And you start in that way to where you're slowly reintegrating things. If you've been doing that with your partner all along, where there's been erotic massage and you've been connecting in that way, then it will be an easier transition. I mean, that could be something where it's every couple is going to be different. So it's just recognize where you're at and the level of physical intimacy you've been having previously. And we just want to make sure that we're not trying to, like, let's crawl before we walk, before we run.
Right. And I really like your restaurant analogy. I worked in the restaurant industry before I was a therapist.
Me too. Everyone with a college degree, I think, probably did that.
And, I think of the customers who were not satisfied with whatever they tried. And so management, you want to give good business. So you say, well, is there anything else you wanted to try? Can we try something else? Versus just, I'm never coming back here again. When there's like so many other things on the menu that you just never even looked at. So that it's okay to change your mind, and what feels good one day might feel different the next.
Yes.
And a big thing that comes up physically with physical therapy is just try a different position. Just do it differently.
Mm-hmm.
Differently and see how it. But the hard part is you don't want to keep creating the negative body memories when it does create pain. So communicate with your partner. Oh, never mind. Doesn't feel great. Try something else, right?
Yeah. If something's painful for more than 30 seconds, I really don't think that it should be continued. Right. That I think that, if you go for 30, and this is kind of a random number. And so with clients, I'll say, like that if it shouldn't be unbearable. If there's discomfort and you say, oh, wow, that's uncomfortable, slow down, stop, let me see, let me breathe into it. And then maybe you breathe into it and you go, oh, okay, now that feels okay. So we don't want to be really quick to say stop. But at the same time, we really want to have boundaries and direct communication. And if you have a history of pain, making sure that there's enough lighting to where you can have eye contact with your partner, because a good restaurant has managers that are checking in and they're like, oh, you haven't eaten anything off your plate.
Wrong.
Is it okay?
Mm-hmm.
That they're checking in. But if your partner can't see your eyes, they can't tell if you're in pain or you're experiencing pleasure. So it's important for them to be able to see your face. And there was something else that you said that I really liked with regard to the food analogy is like, oh yeah, you don't have to say that just because I don't want to have intercourse, I'm not going to have tapas. But then also, I think you were alluding more towards even like just some other specifics within it, where it's like, oh, you're touching me too rough.
Mm-hmm.
Let's not say you're too rough. Say, oh, can you do more gently, please? Or like 20% less pressure, that sort of thing, to where we can give them the direct understand like what we're needing. I need more gentler, please. But when we say, yeah. And when we say it, things that are like, ouch, that tickles, or it's like, oh geez, I'm fucking up here. I'm just not doing a good job. Okay. So, I mean, now they're going to feel insecure, and the energy is it's just, yeah. So we want to be compassionate that even though sometimes it might feel like our partners are being self-centered and just want something for themselves, they have emotions too, that they don't want to feel criticized or inadequate in that experience. So, just being compassionate with that. Yeah.
So we mentioned it a little bit earlier. So obviously with quarantining and COVID, intimacy, I mean, for better or for worse, everybody's stuck at home together. So whether or not that means more versus less sex and all the kids are home, can you speak to what you've seen with your clients and what you kind of advise people to do given those circumstances?
Yes. Yeah. I mean, this is so hard right now. I really think everyone is struggling. And I mean, you're probably lucky if your partner goes to work outside the home. And yet for some people that might not feel so lucky, because for some people it might feel like dangerous, where their partner comes home, maybe if you're a first responder, feeling like, are you bringing germs home? Is our family going to be safe? Is my partner safe? And so it's so surrounded by stress. So first and foremost, there's just a level of stress that we're all experiencing in whatever, because we're all having different reactions. We're having battles with friends about whether we should be wearing masks or whether we shouldn't. We're having battles with people about, kids not going to public school and being at home. There's so much controversy right now. I mean, I look at it, it's almost like there's like religion, politics, and COVID. Like now there's one more topic that we're not supposed to talk about. I mean, we're never supposed to talk about sex, but I mean, that's off, like, I don't worry about that one. But so there's just like a constant level of stress that I think is above what people have been experiencing. And then on top of it, a lot of people are having some financial burdens added to it. And then we've got extra kids at home.
Yeah, no childcare. Yep.
Oh my gosh. And then add to it, if both of you are at home 24/7, fire needs air. As Esther Perel says, this great sex therapist that does lots of talks, and it's so true. If you don't get any air, you get no energy to long for your partner. Mm-hmm. That there they are in, those old sweats that they've been wearing for 10 years. They're just like, oh my God, really? Can we burn those fuckers? Like, oh, I'm so over it. And then, now they're eating, their chewing has started to annoy you, and then they're talking loud in all those Zoom meetings. Oh my God, do they have to talk so loud? They've repeated that story in every single meeting. Do I really have to listen to that one more time? So, I mean, I really think this is just, it's so much. Right. Yeah. So people who are able to go to their office, like myself, I'm so lucky that I get to be able to, whether or not I'm doing online stuff, I'm going to the office. I need to go get some private time. Then at least we can remove ourselves. And also then we can start to differentiate the different roles in our life. Mm-hmm. But it's like, if we are at home and we've got our office in our bedroom, we've got our kids going to school in the kitchen.
Yep. Mm-hmm.
We've got our partner having their office in the living room. I mean, there's no separation of our roles. And so I think it's just everything gets blurred, and then there's no space. It's just the fire burns out, where it's like, it just burns out. And so I want to just really, really normalize that COVID isn't sexy. It's
Yeah.
just really not sexy. And so those of you, and oh my gosh, people who have had a baby during COVID, oh my gosh, that's just crazy difficult and so courageous, and you're surviving.
Right.
And people who are in survival are not horny, because when I think, there's an animal instinct here. You can't run as quickly when you've got an erection. Okay. You need, and you can't hide with an erection either. So, survival mechanism, it was meant.
Over. Yep.
Yeah. So there's nothing sexy about when we're in survival mode. There's no sexuality going on. And so the more that you can be doing things to fill yourself up, to take care of yourself, to create space between you and your partner, to recognize that the annoyances and the irritations that you're experiencing with your partner are typical, and that the whatever you focus on gets bigger, right? So if you're focusing on all their annoyances, you're not going to want to go have sexy time with them.
Yeah.
You need to focus on the things that you like about them and that you appreciate about them. And sometimes you got to get out of the house to do that. because when you're there with them, you're like, all I can think about is what you're doing that annoys me.
Right.
So yeah, so I just really want to normalize that. And the more that people can get space, go for a walk. People, you have to be leaving the house every day at least 15 minutes. Have to. This is a number one. Okay. If you got to get that baby out there, whether you're taking the baby or not, you got to get out there 15 minutes, go for a walk, go get some air. You need to remove yourself from this cage in which we are in. And you need to connect with friends. And if you don't feel comfortable doing that physically, you need to video chat, you need to call them, you need to connect with them in that way. And then you need to get some sort of intellectual stimulation, reading something, doing something that makes you fills up this brain of yours. Yeah. And then in terms of the psychological, depression is at an all-time high for lots of people. Anxiety is at an all-time high for lots of people. And being able to get the mental health support that you can get, it's so easy to get a therapist now because everybody's on video chat. So you can get somebody, but the problem is it's hard because you may not have privacy at home. So it's like you're going, I don't want to do the therapy because I have no privacy. Go in your car. I have plenty of sessions with my clients and they're in their car on their phone, and that's where we do our video chats, and it works just fine.
Just change of scenery is sometimes very helpful, no matter how small, right? Walk outside.
Yeah. Yes. Yeah.
So other than, I think we covered a lot. So thank you for all responses. I think the last thing before we close out is, what does a sex therapy session look like? Because maybe people have experience with a LMFT just for couples counseling, but how does it change? What does it look like with sex therapy?
Yes. Yeah. So, I mean, it's going to be really similar because I'm an LMFT too. And the idea is that I never touch my clients. I would charge lots more if I did.
I got it. I'll do it.
Yes. And you do the touching, I'll do the talking and the listening. But basically what a session looks like, you can come in individually, you can come in as a couple. That'll be assessed over the phone with me. You know, when you call in and you express your interest in coming, we'll talk for about 15 minutes to assess what it is that you're wanting to come in for, what questions you have for me. I'll assess whether we're a good match or not. And then at that point, that's when I'll make the recommendation of whether you should come in as a couple or individually. Of course, it's your choice as a client, but I'll make my recommendation based on what you've shared with me thus far. And that's a free consultation where we're just kind of assessing whether we're a good match or not. And if I don't feel like you're ready for such an intimate therapy, then I'll say, you know, it might be better for you just to go to see a couples counselor and work on some foundational things before we start talking about the sexual relationship.
The 15-minute phone consult.
The 15-minute phone consult is free, and that's where we're assessing whether, you know, what to do about the therapy. And then if you decided that you want to come in and we're a good match, then those sessions are, you know, I take a couple of different approaches where like I'm looking at it initially, what suggestions can I give to you? How can I educate you in a way that will be helpful in your specific situation? And whether it be some activities, whether it be resources, whether it be some tools, and whether it be referrals to a physical therapist, whether it be suggestions of like, you need to go get your hormones tested, I'll give you the guidance that you need to be able to address whatever sexual struggles that you're having. And that's where that's a little bit different than what LMFTs do. They might be doing a little more listening and about communication and going to the deeper stuff. But I'm trying to give you symptom relief. I'm really trying to give you suggestions so that you can have some relief, where it's like, yeah, here's some suggestions for lubricant. It's as simple as that, you know, it may be the basics. But a lot of times it's another aspect of our therapy is there's something deeper that's affecting it. Do you have a trauma history and that's why you're having this pain response? Is there a difficulty in your relationship that we need to work on? How the two of you are, the emotional safety? Is there some childhood trauma that is getting activated now that you have a child of your own that maybe you thought like had gone away? But so if the surface level sort of tools, resources, suggestions, education isn't addressing what it is that is specific to you, then I'm looking at the deeper stuff so that we can get some sustainable results.
Right. Yeah. It's very similar to the physical therapy too, because everybody comes in thinking like, are you going to do you use a speculum? Because last time that happened, it did not go well.
Yeah.
You always have to explain, well, first we're orthopedic therapists. So everybody thinks of physical therapy, oh yeah, I hurt my back or my shoulder. When in reality, it is related, because if somebody says I have pain with sex, I tried lubricant, it didn't change it. I tried, foreplay, didn't change it. And then we get to the root of it. They're like, oh, well, this position is the worst. And I'm like, well, maybe it's the position. And then like, oh yeah, I have a bad hip. I tore a labrum, I tore my hip when I was a runner back in college. I'm like, well, there's your root. There's your deeper, let's address that too. So I think it's good for people to understand it's not always hypersexual. It's a lot of there's a lot of layers to kind of uncover before you can just say, okay, this is what we're going to do in the bedroom, versus there are some other contributing factors, right?
Yeah. And I'm always looking for, is the sex worth wanting? Because if you're coming to me and you say you have low desire and then you tell me it's not worth wanting, I'm like, well, that's the problem. Right. Your desire is, of course, you have no desire. Like, I'm not going to go to a restaurant that has shitty food. like that makes sense.
Yeah. Well, that was all great. I think we covered a lot of great topics, and I know this will be recorded so people can refer back to it. Mm-hmm. But in closing, aside from saying thank you so much for spending a little bit of your afternoon with us, what other resources do you have for people? How can they contact you? Where can they reach you at, and all of that?
Yes. So they can always go to my website. That's real easy. Talk Sex with Liz. And that is where you can find me on social media as well. And so if you want to go to Instagram, if you've got some questions that didn't get answered today, that are specific to you, that you're feeling shy about asking, go DM me on Instagram. Follow me, and I always answer all my DMs there. And so message me there. If you want to just go to my website and read my blog, check it out. It's under talksexwithliz.com. Click on sex ed, and then you can look at my blog. You can look at previous podcasts that I've been on and hear about topics that are going to be relevant to you. There's lots of blogs. I love to talk sex, and so any topic is probably there for you to find.
And you are still doing online or virtual phone call sessions as well as in person?
Yeah, so I'm doing video chat, I'm doing telephone, and then I see clients in my Long Beach office.
Awesome. All right. Well, we'll go ahead and forward all of that information, your contact info, to everybody. We'll give them a link to your website, and hopefully if they need the help, they know where to find it now if they're local.
Yeah.
Because it's virtual. So
yes. Yeah.
Thank you so much for your expertise and all the specific details and practical strategies to start thinking about. So we will maybe have to do a future part 2 on more specific topics, but I know.
Yeah, I'd love it.
I know you got patience, so we will be in touch. Thanks so much.
Okay, thanks. Okay, bye-bye.